Hello, my name is Elizabeth Mziray. I'm a senior operations officer at the World Bank, working on health in East and Southern Africa. My leadership project focuses on integrating sickle cell disease into primary healthcare in Africa by utilizing the transformative power of storytelling. Stories connect us in ways that data alone cannot. They move us and they inspire action. I stand here today not just as a global health professional and a participant in this incredible leadership journey, but as a sickle cell warrior. I know firsthand what it means to live with the disease. Sickle cell disease is an inherited blood disorder caused by a mutation in the hemoglobin gene and is characterized by excruciating pain episodes. It affects over 8 million people globally, with over 75% living in sub-Saharan Africa. Every day, approximately 1,000 children are born with sickle cell disease in sub-Saharan Africa. Sadly, depending on the country they are born in, 50 to 90% will die before their fifth birthday. Countries with high prevalence of sickle cell disease include Nigeria, DRC, Ghana, Uganda, and Tanzania. Sickle cell disease places a unique burden on women, including complications during pregnancy and childbirth, delayed puberty, and fertility issues. As primary caregivers, women often sacrifice their education or careers to care for children affected by the disease. While sickle cell disease was formally described in 1910, it wasn't until 1998 when the first drug, hydroxyurea, was approved by the US FDA. For decades, sickle cell disease has been neglected due to stigma, its disproportionate impact on marginalized communities, limited advocacy and awareness, underdiagnosis and lack of data, as well as fragmented healthcare systems. Yet, with the right investments, it is a condition that can be managed effectively. Through these stories, my leadership project will amplify sickle cell voices and women's leadership to educate the public on sickle cell disease and its impacts, especially on women, to inspire changes to address sickle cell disease more effectively, and to advocate for increased attention, including financing for sickle cell programs. The project has 4 phases, beginning with story collection and production, followed by raising awareness among global health leaders through different events, culminating in a blog post or op-ed that ties it all together. From my conversations with sickle cell warriors and caregivers, key themes have emerged, including delayed diagnosis and lack of newborn screening. All the sickle cell warriors that I spoke with were diagnosed between the ages of 3 and 18. They also spoke of limited access to life-saving medications like hydroxyurea, as well as stigma and discrimination due to misconceptions about the disease, mental health issues, substandard care for sickle cell pain crises, and resulting complications. I was really inspired by the strength and resilience of sickle cell warriors, despite the challenges that they face. My next step is to curate and share these stories with policymakers and global health leaders to inform the integration of sickle cell disease into primary healthcare. With my manager's encouragement, I have the opportunity to create a mini leadership journey for women in my workplace. I've had initial discussions with WomenLift Health and look forward to expanding the impact of this transformative experience. The leadership journey has been pivotal in my growth as a leader. It has deepened my self-awareness, enhanced my ability for authentic leadership, and reaffirmed the impact of purpose-driven advocacy. I am now part of a sisterhood in global health, an inspiring community where we support, uplift, and celebrate one another's successes. I would like to thank my manager and colleagues for their input and support, and the sickle cell community for sharing their deeply personal stories with me. Finally, I'd like to share a video that provides insight into what it's like to live with sickle cell disease.
Price, place, and Anyone?
Living with sickle cell disease, it's torture.
John, let's have you share with the class.
Everyday tasks can be filled with pain. I am one out of every 365 African Americans who have sickle cell disease. You can't see our pain, but please believe it.
Thank you for your time.